Hi everyone. We talked about the acute symptoms of sickle cell the last session. I want us to talk about the chronic symptoms of sickle cell. All right, let me just start by saying that because of the episodes of crisis that we usually get, it tends to damage our organs. So we'll talk about just three organs. Talk about the liver, talk about the lungs, talk about the heart. All right, so let me just say that with that of the heart, so with the heart, chronic anemia can lead to more output or more cardiac output. What I'm trying to say is that the heart will tend to work more. So let's say if a regular heartbeat has to do with 60 to 100 beats, it will go beyond. And when it goes beyond, definitely it leads to cardiac arrest or cardiac failure. So that has to do with the heart. And with the lungs, this is what happens. So with the lungs, there's this threatening condition that we call ACS. Yes, that's right. Acute chest syndrome. Now with ACS, it attacks you. It comes with pain. That's like chest pain. Then persistent cough. Then I think shortness of breath. So if the ACS is not treated on time, not treated immediately, then the lungs, what's the right word to use? So if it's not treated on time or in time, then it inflames and damages the lungs. That has to do with the ACS. Then lastly, that of the liver. With the liver, repeated episodes of crisis can accumulate the normal red blood cells, or accumulate the abnormal red blood cells, and at the end, it also inflames and damages, And lastly, one more point that I can say is also part of chronic symptoms, which is delayed growth. Now, with delayed growth is simply the reduced delivery of red blood cells and oxygen in the body. So if it's a child or a teenager, that person or that patient won't be able to grow how he or she is supposed to grow. They'll be, like he wouldn't be able to grow well, or he will look a little bit, like there's something wrong. Yeah, that's like another point that I can add to. All right. Thank you very much. Bye-bye.